an important part of medicine, different in all countries of the world. Is one of the main problems which are decided by practical physicians in any specialty, on outpatient level mostly. This process may be involved neurologists, ophthalmologists, and cardiologists, of course, therapists, and general practitioners. To characterize this process of expert evaluation of workability, this process of this is part of diagnostic function of GP, which solves the problems of maximal or long-term continuum of patient's occupational activity, which of course is necessary for maintenance life quality, prolongation of occupational activity. Also, this process directed on prevention of chronic disease progression, reducing of morbidity, and of course, disability. What does mean workability? Let's remember the of this human ability. It's the condition of our organism which the combining of physical and mental possibilities permits to perform the work of definite volume and quality. This is workability. Loss of work capacity or workability, it is as a state, patient state or condition caused by diseases, trauma, its consequence, or other reasons, then the performance of occupational responsibilities imposed totally or partially during the limited period or constantly. It's the main differential sign between or stable disability. Limited period of disability, typical for temporary. Constant character of disability for stable. And tasks of GP and other doctors' work is to define character or to determine prognosis of patients' work inability. For better understand the process of examination workability, we should remember, we should know main characteristics or categories of labor. 3 categories we can select, we can divide. Well, first category, optimal conditions for work without any harmful factors, poisons, and other unfavorable factors. Second category, permissible conditions for work, permissible. And then the level of environmental factors and labor process exceed the established hygienic norms. And third category, then, which we can characterize as harmful working conditions with presence of harmful factors such as noise, dust, maybe high temperature, and others. As those levels exceed health standards or hygienic norms and have an adverse effect on the human health or human body. All kinds of all variants of human labor or working activity we can classify, divide on two main groups: physical and mental exertion, or labor with prevalence of physical or with mental or psychological exertion. And according to these two types, we can classify working conditions according to intensity of labor during working day, working period. We can reveal work with significant physical exertion. For example, this exertion associated with lifting and moving heavy loads over 10 kilograms for women and over 20 kilograms for men constantly throughout the working day. Being in a standing position for more than 80% of the time. It was work with significant physical exertion. Second category, work with moderate physical exertion. It means lifting and moving heavy loads up to 7 kilograms for women and 15 kilograms for men throughout the working, and being in a standing position to 60% of the time. And most favorable are work with mild physical exertion. It means lifting and moving heavy loads up to 3 kilograms for women and up to 5 kilograms for men throughout the working day, being in a standing position to 40% of the time. I hope you will study this any labor characteristics on 6th year when you will study the course of occupational diseases. A loss of work ability can be temporary and persistent, which I said, it depends on duration, workability. Short period, temporary or long period, persistent. The border between both types of this loss of workability, it's relatively 1 year, more than 1 year, persistent, less temporary. Now let's specify a definition of temporary disability as pathological condition or a state of the human body caused by the disease or any injuries or other reasons for which the disruption of body is accompanied by loss work ability to carry out professional activity, which is, let's underline, which is irreversible, short duration, and favorable clinical and occupational prognosis. Three main key elements of temporary disability. So let's repeat again. Reversible character, short, relatively short duration, less than 1 year. And the third is the favorable clinical and occupational prognosis. In usual practice, temporary disability develops with 60 to 80% of all patients. All these patients, they're treated preferably on outpatient level, so in GP, under GP control. Temporary disability, all cases of temporary disability, we can divide on two subtypes. On total and partial temporary disability. As for total temporary disability, it's condition when patient temporarily cannot work and needs a special regime for restoration of his or her ability to work. The main causes of this type of temporary disability: acute viral diseases such as acute respiratory viral infections, urinary upper respiratory tract infections, COVID-19, of course, or exacerbation of chronic diseases such as bronchial asthma, peptic ulcer, chronic pyelonephritis, and others. Second subtype of temporary disability, more favorable for maintenance of workability, it's partial temporary disability. This condition, then a patient cannot perform work in main profession, main occupation. For example, patient's taxi driver cannot drive after hand injury. But without the dangers to his health, patient may perform other work of low qualification. For example, our taxi driver can work as driving instructor in driving school. Or he can work in call center or in service center for impairment of taxi car. Now let's enumerate the main causes of temporary disability. There are disease or diseases, chronic, acute, exacerbation of chronic diseases, of course. Different types or kinds of trauma. Separate course of temporary disability is professional or occupational disease, which require more deep assessment of occupational conditions and more deep expertise of workability, because it requires to investigation of documentation, technical and hygienic documentation about main characteristic of patient's labor. Excuse me. Complex diagnostic procedures, it's also a cause of temporary disability for short period on 1 to 2 days, usually, or 10 days, which we should permit for patients for qualified for enough preparation for any invasive procedures and for rest, for restoration after invasive serious procedures such as any endoscopic examination or coronary angiography with contrast. Next cause of temporary disability is nursing for sick family members. At home or in hospital. But for this case, we can permit not so long period of disability. In Russia, it takes not more longer than 7 days. Disability, temporary disability while pregnancy and childbirth period, after delivery period. In Russia, this time it takes around 2 years. Post-vaccination complications, this course of temporary disability was, we can tell, very popular or very often. Last year, due to very widespread vaccination against COVID-19. And the next course also very close associated with COVID-19 infection, quarantine. Quarantine, the period of quarantine, isolation, depends on some characteristics, typical characteristics of a concrete disease. Usually it takes 2 weeks after contact with infected person. Now let's specify which document GP or any doctor of any other specialty should fulfill for confirmation of patient's temporary inability for work. It's sick leave certificate, so-called sick leave certificate. I want to inform you about universal instrument for assessment of workability, so-called workability index. No, this index we can use as approximately scale for detection of expressiveness or severity, patient's work inability. We can ask our patient about his or her current workability compared with the lifetime best. Workability in relation to the demands of the job. Number of current diseases diagnosed by a physician also. It's a very important component. If more diseases accompanied or diseases of different systems which can potentiate the gravity. It's not so pleasant sign of for treatment and for prolongation, not so factor for returning to patient's work. Estimated work impairment due to disease, also we can estimate from 1 to 6. Sick leave during the past year from 1 to 5. It will depend on frequency of sick leave registration for last 20 months, 12 months. Own patient's prognosis of workability 2 years from now. And also we should estimate patient's mental resources. On this table, you can see so-called approximately average workability index according to patient's occupation and according to patient's gender, age adjusted in periods between 30 to 64 years. Highest workability index for patients, for managers and senior official. You can send first plate. For teachers, for physicians, or other healthcare experts. And minimal workability index for patients of agricultural and forestry workers. And now let's characterize disability or stable or persistent disability as a more serious problem of health associated with disease or traumas, usually. World Health Organization estimates that almost 15% of the world population has a disability. It takes many millions of people which require special regimes of treatment, prolongative courses, repeating courses of rehabilitation and care. In Russia, more than 15%, approximately more than 16% of population have some degree of disability, and the number of lost years of working lives was 10 years in 100 people. According to our country Agency of Social Protection, not less than 15 million disabled persons in Russia. Definition of persistent or stable disability, it is, note your attention on underlined words, social failure It's obligatory criteria of persistent or stable disability. This failure developed due to health problems with the persistent disorder of body function or functions, persistent disorder of body functions. It is so-called second criteria of persistent disability. And the last or third criteria is limitation of vital activity. Persistent disorder of body functions leading to the limitation or limitations of different kinds of vital or life activity. As for persistent disability, it's a long or permanent disability caused by illness or injury, which led to a prolonged disruption of body functions. It's relatively simple. Definition was more correct. And else one important term, social protection. Right. All patients with stable disability require social protection, constant or periodic. Social protection is a system of constant government guaranteed and long-term economic, social and legal measures to ensure that people with disabilities to overcome the conditions, substitution or compensation, disability, and aimed at the creation of equal opportunities with other citizens to participate in social life. It's a system of long-term care for social protection. Or social support, of course. Now let's remember main characteristics of health, which we should know for correct description of patients' health disorders. What does it mean, disorder of health? It means physical, mental, and social disadvantage. Physical, mental, and social disadvantage associated with the loss, abnormality, disorder of psychological, physiological, anatomical structure, and other functions of the human body, and the need of its social protection, patient, person, any person, or assistance. Needs social protection and or assistance. You should know that public health organization system, they were recommended to calculate so-called integral statistical index of the severity of persistent health problem, and one of the most important problems among this structure is life expectancy in years with disability. Or by other words, it is life expectancy with disability or disability adjusted life years, which we can characterize as the sum of years of life are lost from premature mortality or due to living with disability. Life expectancy years with disability. On this picture, you can see some examples of this parameter calculation. Green colors, color parts of these columns characterize disability-free life expectancy at 65 years, number of years. For example, 11.5, 11, moderate is 11. According to different age periods, it was measured. And second component of above disability-free, expected years with a disability after 65 years. Mean value, average level of years with disability, around 9 years. So together it takes around 20 years. 65 years old. The prolongation of duration of patient's life. Half of them of this period will take disability period. Main causes of persistent or constant stable disability are general disease, so-called general diseases such as diabetes, such as ischemic coronary artery disease, such as bronchial asthma. Occupational diseases or diseases associated with harmful professional occupational factors, such as vibration, high temperature, cold temperature, low temperature. Maybe sometimes ionizing, contact with ionizing radiation, or contact with toxic factors, toxic or dangerous factors, such as coronavirus infection. Employment injury, some sudden cases of occupational traumatism, for builders, possible for military or soldiers. Disabled since childhood, it's also possible, for example, for Down syndrome patient, or spinal atrophy childs. Disability associated with fighting military trauma, I said it is obtained during military service. And disability associated with the harmful effects of ionizing radiation. Separate kind of disability which requires specific diagnostic process, organization, and correction after that. Main causes of stable disability. In all countries of the world, almost 50% takes cardiovascular diseases, including cancer, stroke, including myocardial infarction consequences, chronic heart failure. On second place, cancer, 10%. Of course, malignant tumors. And as for other groups of diseases, approximately 6% for each other. Nervous system diseases, Parkinson, Alzheimer's, stroke consequences, traumatic injuries after accidents, mental disorders after stroke, after chronic brain ischemia, respiratory diseases, COPD, bronchial asthma, gastrointestinal tract diseases, including diabetes mellitus, pancreatitis, peptic ulcer, and musculoskeletal system problem. Now let's start characterize the main types of persistent functional disorders. First type is disorders of mental functions, which GP can detect for patients, especially for elderly patients. We can detect it by checking of patients' attention or memory, by repeating of few words, or psychomotor activity. We can estimate emotional level or emotions, orientation in time, place, personality characteristics also we can estimate, personality characteristics. Another group of functional disorders persistent includes disorders of speech and language function, which can cause some problems such as aphasia. Of course, it requires special training from neurologists usually for correct and timely detection of these oral disorders. Writing language disorders, dysgraphia, dyslexia, verbal and non-verbal speech problems, and violation of voice. As for disorders of sensory organs or sensory functions, for detection of these disorders, we should check vision, visual acuity, hearing, characteristics, smell, touch, tactile, sensitivity, pain, sensitive temperature, sensitive vibrational, and other kinds. Vestibular functions also, and pain sensitivity we should define. Neuromuscular disorders, static skeletal and static dynamic function, we can estimate by checking of movement of the head, body, and extremities, including bones, joints, muscles, and static coordination. Other group is disorder of the cardiovascular, respiratory, digestive, and endocrine system, metabolism, blood and immune system, hematopoiesis, proliferation of blood cells, function we can estimate of urinary tract, so-called, for example, glomerular filtration rate, we can estimate. Skin functions, barrier functions, protective function, and related system. It's a general class of functions which require examination. And the last slide before break, disorders caused by external physical deformity. We can estimate deformation of patient's face, head, trunk, extremities, as you can see here, leading to an external deformity. And abnormal openings of the digestive, urinary, respiratory tracts, and violation. We will continue after break, 10 minutes. Group leaders, please, as usual, my request for you to write on our chat the present amount of the present students. 10 minutes break, thank you. Please. Let's continue our work, students. Next question, which we'll discuss, how we can estimate severity or degree of persistent functional anomalies. First or minimal persistent minor abnormalities of human body caused by disease, trauma, or defects usually in interval of in the range of 10 to 30% from initial level. Second degree, moderate persistent abnormalities of the human body caused by disease, trauma, or defects in the range of 40 to 60%. Third degree now, persistent expressed abnormalities caused by other different reasons in the range of 70 to 80%. And maximal fourth degree, significantly expressed abnormalities caused by any reasons ranging from 90 to 100% of function lost functions. For example, for patients with amputation in extremities due to diabetes mellitus. And now we'll characterize second most important criteria, criteria, persistent disability, diagnostic criteria, limitation of vital activity or life activity. According to definition, it is deviation from the normal level of human activity as a result of ill, limited ability to perform self-care, independent movement, limitation in place or in time, ability to communication, control their behavior, patient behavior, ability to training or education, and ability to employment or work. So 7 kinds of abilities. Patient can name 7 groups of abilities, and all kinds of these abilities, disorders or limitations we can detect during our working activity. According to classification, we can detect 3 main grades of the vital activity limitations. For each type of limitation, all these degree are different. For example, let's characterize each other. Ability to self-service. What does it mean? It's ability to independently meet the basic physiological needs, independently performed, to carry out activities of daily living and personal hygiene skills. First degree of limitation. This ability, it means maintenance ability to self-serve for longer time of its implementation, reducing the volume if necessary, or by using assistive technology. Second degree, the ability to self-sufficiency by means of aids and care or by other person. And third, maximal similarly expressed degree of inability to self-service needs in constant assistance and care and complete dependence on others. The third maximal degree we can illustrate by example of patients after severe stroke. Next type of life activity limitations, limitation of ability of independent movement. Its ability to independently move in space, to maintain balance while moving the body, then the household or occupational activity. First degree is limitation, means the ability of independent movement to travel for longer time, fractional performance and reduce the distance if necessary, and using assistive technologies. Second degree is ability to independent movement with the regular partial help from others if necessary and using assistive technologies or technology. So, for example, stick. And third degree means the inability of independent movement and needs in the constant help of others. Next type of disability, ability to orientation. Ability to orientation is the ability to adequate perception of the individual and the environment, assessment of situation by a certain time and location. First degree is the ability for orientation only in familiar situations on their own and or with the help of assistive technologies such as clock, such as compass. Second degree, the ability to orientation with regular partial help of other people if necessary and using assistive technology. And third degree, inability to orientation and disorientation and constant dependence from others and necessity from supervision of others. As an example of this dependence, patients with psychiatric problem such as schizophrenia, Alzheimer's disease, and others. And of course, the ability to work. Let's characterize this type of ability to carry out occupational activity in accordance with the requirements for any occupation content, quality, and conditions. First degree of limitations as disability means maintains ability to work at lower qualification or decrease the volume of performing work. Inability to continue to work on the main profession while maintaining the ability to work lower qualifications. Second degree, ability to work under special conditions using assistive technologies. And third degree, inability to perform work in connection with severe impairment of body functions. After, for example, severe trauma, inability to perform any work. Ability to control behavior. First degree, partial decrease in the ability to control their own behavior. Second, ability to partially or fully control behavior only by unauthorized persons. And third degree, the inability to control behavior according to and full dependence from supervising person or relatives or social care workers. So also as for patients with disorders of R2 orientation, this group we can characterize as patients with psychiatric disorders. Next group is next kind of limitation, ability to communicate. This limitation or this ability to establish contacts with people by sensing, processing, and communication of information. For some occupations, it's especially for journalists, it's very important. For doctors too. First degree, the ability to communicate, characterized by a decrease in the rate, the decline in assimilation, receive, and impart. Second degree, the ability to communicate with the use of aids and or by other persons, by relatives, for example. And third degree means inability to communication due to speech problems after, for example, severe stroke. Now let's enumerate main criteria for disability. There are stable, of course, or persistent disability. Estimation for this disability estimation, determination of persistent dysfunctions of any system caused by disease, consequences of traumas, resulting the limitation of the vital activity or activities or combination thereof, determine the need for its social protection. So limitations of ability to self-service, the ability of independent movement, travel to orientation, communication, control of behavior, to learn or to education, and to work. In different countries, the function of confirmation, expert confirmation of stable disability science can perform so-called different medical organizations. In Russia, this role performs Medical and Social Expertise Bureau. Medical and Social Expertise. These organizational functions are medical and social examination on the basis of assessment of disability, signs of disability caused by persistent disorder of body functions. Next function, confirmation of disability, its causes, determination, the degree of occupational disability in percentage of lost function. And a very important component, also a composition, the individual rehabilitation programs or program. But composition, the individual, or the requirements for compositions, individual rehabilitation program, and main principles of rehabilitation we will discuss on next lecture. And today we came to conclusion that early detection of disability signs in outpatient practice contributes to the timely appointment of rehabilitation program for patients, preservation of their independence, and maintenance of life quality. You can underline from this conclusion, timely appointment, timely detection, and early detection, timely appointment of rehabilitation program can protect, can prevent this serious medical and social problem. Now, you can ask me any. Thanks for your feedback from about present our lecture. All other problems, more detailed maybe, methods of diagnostics, patients' functional disorders, you will detailize with your teacher on practical classes. If you have any questions, let's complete our today's communication, today's meeting. And see you 2 weeks later. It will 1st of April, as far as I understand. So good luck, healthy. See you later.
До свидания.